Patty Stalker here from WestfordCAT, and I have with me my guest is Jeff Stevens. He is Westford's health director, and we've been trying to. I'm doing good. I'm doing great. Thank you. How are you?
I'm doing well today.
Good.
Can't believe summer's almost over.
I can't either. August 26th, man. I went fast for being, housebound for the majority of it. So we've got a lot to cover today, and so why don't we just jump right into it. First of all, I'd like to talk a little bit about Westford and the COVID-19 positive cases. Are they stabilizing? Are they going up or down? That sort of thing.
Well, currently our caseload is fairly stable, and what we're actually seeing more of is households that are getting sick as opposed to widespread population of people getting sick. Currently, we're seeing bigger households contract it, they become better, and they come off. So our numbers fluctuate quite a bit. And as of recent, that fluctuation has been due to that fact that, say, a family of 4 or family of 5 becomes infected, and you'll see the numbers jump from, say, 2 to 7 in a matter of a day. And that's not indicating widespread outbreak in town. That is indicating somebody may have traveled and got sick someplace else, or a family member came and they got sick, or whatever their method of transmission was. We know there's widespread spread transmission in the state. It just means as a family unit, they got it together. So the number can be deceiving. And I'll do the best I can to let people know when I feel we should be getting more restrictive on what we're doing. But currently, based off of what I see, we're kind of holding steady. I do have the numbers broken down by age group, and I can run through those really fast. So I'll just wait.
Sure, that'd be great.
As of today, our 0 to 19 population has had, since we started in February, 17 cases. And like I said, that's over 6 months worth of data right there in that age group. And when I break that down even further, in many of those 17, it was an infant or a toddler that was sick because a family member was sick. We haven't had a lot of teenagers that have come down with COVID at this point, which is very good and encouraging. The next group is age 20 to 29. There have been 21 people in that same time period that have been sick. The age 30 to 39 has seen 15 people. The age 40 to 49 group has seen 21 people. 50 to 59 has seen 42 people, and that's our largest age group of where we've seen illness. Followed by our 60 to 69 people, which has been right around 24 people. Additionally, the 70 to 79 is 23 people, and the 80 plus is 29.
So do you have a reasoning behind the 50 to 59? Do you think it's because they have, college-age kids or teenagers generally?
I only have a theory, and I think you kind of touched on that, is that people in their, say, early 50s, they've got kids in college or senior parents, and they're in touch with a lot more people.
Mm-hmm.
And I think why that number is often bigger. Our smallest group of 0 to 19 and 30 to 39. I mean, the 30 to 39 people I feel like are often just working with their own bubble. They're staying in their own places. They're doing their own things, and they're often separated out from the rest of society. But I think you're seeing that 40 to 49 and 50 to 59 group, they're doing more for others. And the fact that it's usually parents that they're helping maintain. And like I said, it's only a theory. Additionally, when I look at the numbers from just a couple of weeks ago, almost 3 weeks ago, our numbers are indicating that our Basically from age 70 up, we've only had one case in town, which is great news for the senior population that
Right.
they've done a really good job of uh, keeping up with the big three of wearing their masks, socially distancing, and sanitizing their hands, which is great news for them.
Let me ask you, Jeff. Have you seen or have you got a lot of complaints or many complaints of businesses or people that are not being compliant in town?
Well, it's been our experience so far with Westford businesses in town that everyone is trying as hard as they can to comply with all of the Department of Labor and standards regulations. So I'm very proud of all of our Westford businesses. I think they've done a great job. However, there are certainly people that view things in either their own way or observe a violation, whether it be intentional or unintentional, and do report to us. Or they
Mhm.
report to the Department of Labor and Standards, and that complaint comes to us. I would say we're probably getting anywhere between 2 and 4 a day on
Wow.
situations.
Wow, that's more than I expected.
It's it's a we investigate nearly all of them, and it's often things such as social distancing at sporting events, such as youth sports games, or a complaint that people doesn't have they don't have a mask on or socially distance in a store or restaurant. We'll go investigate the situation, find out what's happening, and oftentimes we're not able to actually see the violation the person that made the allegation told us about, but we do let the establishment know that, hey, there was a complaint, make sure you're staying on top of it. And everybody has been really good in knowing that, hey, we have to respond. We all know that this is an unprecedented time, and everybody's working pretty hard to try to get it right. We haven't had too many blatant or flagrant violations of people just ignoring what the rules are. But when we have people that have had an obvious violation, oftentimes we find education is the best way to solve that.
Gotcha. Yeah, as opposed to finding them or that sort of thing. But like you said, it's probably kind of hard to enforce something that you haven't seen yourself. So letting them know there's been a complaint, I think that's a good way to go about it. It's keeping you very busy. I see. Though you're getting 2 to 4 a day, plus what you know your other duties.
Yeah, so it's a lot of just trying to keep up with what people see and they have, and we do respond because we take it seriously. I mean, if we're seeing the same complaint over and over again, uh, we may be put in a position where we have to issue a fine, and we don't want to get on a punitive road in my office, but we're prepared to do so if we have to. It's not really our goal. Our goal is education and making sure everybody stays healthy.
Terrific. I was going to ask, have you had very many repeat violators?
It's when we have a repeat complaint, it's usually on mask wearing complaints. And some of those things we may not be able to control. There may be a person that goes into a store that doesn't can't wear one, or maybe forgets it, and they just walk in, and maybe a store manager or person doesn't see them right then at that time. But what we found is most stores, when they see you without a mask, they're going to stop you and say, "Hey, you got to get it on."
Last week, the state of Massachusetts, I don't know if it was the Department of Education or if it came down from the governor, maybe you could clarify that. But I do know that any child entering a public school in Massachusetts has to get a flu vaccine.
Yes.
So, how are you guys handling that in town? What are the clinics going to be? That sort of thing.
So right now we are actually gathering all of our vaccine from the state, and we order it from one vaccine company that we're comfortable with the brand and the type of vaccine. And we're waiting. Once we get that in, we'll then start scheduling up our clinics. Usually the middle of October is when we're starting to shoot for our clinics. We always run a senior clinic at the Franco-American Club, which has been very successful. And we've run others at the Millennium Building. And currently our plan is to use those two facilities again, but we're going to obviously need to modify how those clinics will run to accommodate for COVID precautions. And we are continually on the phone with the MRC and our nurses to make sure we've got those parts in place. And I would say within the next week or so, we're going to be able to announce when our clinic dates are, when we have all our pieces in place. And our biggest message to people is to make sure that when you come to a clinic, you are prepared to wear a mask, because we will not vaccinate anybody in the building without it. And it's we're going to have a process. It's going to be a little bit slower to make sure that we're socially distancing people, and we're going to do the best we can with that. But as far as getting the vaccine itself, there'll be nearly nothing different. We are using exactly what the protocols from the CDC are for the healthcare providers, and we are getting the forms completed now. We're looking to do everything electronically to try to eliminate the amount of paper that we have. I don't know how possible that will be, but that's what we're going to shoot for. At the very least, the forms will be electronic available, so you can fill them out, show up with it done, and then all we need to do is verify it for accuracy, and then you can get vaccinated and be on your way.
For students, though, are you pushing the clinics up? So do they have to be vaccinated before they actually enter school? Or is there like a time frame?
Technically, they need to be vaccinated. It's part of the mandate that the state put out there. We're not going to, a lot of people are going to go to their own private clinics and doctors.
Correct.
Do that. And over 80% of the students in the Commonwealth already get vaccinated. So this push for the other 20% is just try to bump that number up a little bit. We're working on how we're going to be able to run flu clinics in the schools. We don't have a lot of participation in the schools, mainly because so many Westford kids get vaccinated already. But we still pick up a few, somewhere around I want to say 100 kids last year got vaccinated. But running those is going to obviously change with COVID precautions. So we're just trying to iron out how that's going to really work for us, and making sure not only our healthcare workers are safe, but our students and student body and teachers are safe when we're doing that. Everything will have a different feel this year, and nobody really likes it, but we're going to get through it.
We're all just trying, you know. So what? Oh, I'm sorry.
No, that's all it is. Just everybody's trying.
Yep. So what about AAA? What's the update on that?
So right now we are considered low risk in Westford. That's good. Part of our AAA program is when we go out and do all of our stable inspections, we do remind everybody who owns a horse or farm animals that if there's a AAA vaccine they can get for their animals, we recommend they do it. I think a lot of our Westford people do that, which helps our area stay low, I think. And once we have positives in the area, we continue to get the education out there on making sure that you're wearing bug spray, something that's approved, something that's got a certain amount of DEET in it, 30% at least, wearing long sleeves and long pants at the right times of day, making sure that infants and people who are compromised are not out at dawn and dusk. And we do have a mosquito control program that it's called an adult deciding program, where we do have neighborhoods sprayed at least a couple times a month if people are looking for that service.
And you can also call the mosquito control.
Yes, you can.
And have them come out to your property if you'd like. They come and check it out.
The Central Mass Mosquito Control Commission will definitely come out, and they will treat neighborhoods. So if you live on whatever your street is and you want to get your neighborhood treated for adult mosquitoes, they will come out on the days. And I do believe I have that on our website, and I also have it on the Westford Facebook page. I'm going to pull that back to the front because that's gets pushed down after so many messages. Get that back out.
So hurricane season is not yet over, and we have a Hurricane Laura that is active right now. We've got.
I think we're all very concerned for the Gulf Coast and what Hurricane Laura is going to do. It's projected to be a Category 4 storm that is going to do significant damage to the Port Charles coast down there. And that clearly isn't Massachusetts, and it's clearly not us. But it does remind us that, hey, bad storms and bad weather and catastrophic events can happen in any part of the country. We are not immune to it. I mean, we'll see heavy rains out of it for sure, probably Saturday night into Sunday. And
we've had some windstorms lately too that have caused significant damage in Westford. I'm assuming there could be some winds associated with this hurricane, and just right around the corner is winter, and we've had our fair share of blizzards and high snow totals and windstorms, and
yep.
And so the emergency preparedness. I know that Nancy Burns touched on that a little bit with me. So what do you suggest for people to do when the bad weather is right around the corner? How can we prepare?
So what I think everybody really needs to be able to do is this. Not only do we need to prepare for bad weather, but where we're still sitting in the middle of a pandemic, this is a potentially catastrophic event within itself. Right now, maybe our numbers are stable, but people need to think about, especially in September, where it is Preparedness Month, what are the things that you either need in your house or you need to make sure you have available, or you have a grab and go kit, making sure you've got your basic essentials ready to go, whether it be blankets, medications. During COVID, make sure you've got proper PPE that you can travel with, making sure that you've got an extra couple gallons of gas in the basement, making sure that your propane tanks are filled, your oil tanks are filled, making sure that no matter what happens, you've got the resources you need yourself to survive or just get through whatever the event may be. We've seen the power outages that last several days to over a week, and the ice storms show up in November because of the air temperatures. So those are the things we really need to pay attention to. And one thing I'd recommend people do is, what we've done is prepped a few of these go kit bags where if you do have to leave your house or you do have to make an emergency repair because a branch came down, you've got things you need, like first aid kits. And we always put things like parts in these bags so people have, and a book that you can keep all your vital records in. So if you've got your medical information, if you need it, gloves, ponchos. We actually recommend having crank radios. So if you need to get AM information, which I believe Westford's AM station is 1630, where we'll put information out if need be, you've got it. And basic supplies, just having toothbrushes for everybody in your house and toothpaste, just to make sure that if you get put into a situation where it's cold, you've got to go to a warming station or a shelter, you've got that stuff available, and you're not helpless.
And you're not fumbling around if the power's out trying to find all those things.
Exactly. So what we build here and we recommend is a pretty basic kit, but everyone knows their own family and they know what they need. Having extra food, having extra medications, having extra blankets is something that all of us need to do. We all went through it back in February and March when we were in a pretty big lockdown. We all went to the grocery store and there were essentials that people were having a really hard time getting. So those are the things I'd like people to think about, especially this time of year. Right now, there appears to be a fair amount of supplies in the stores. I'm not saying go fill the shelves to the point where you got too much stuff, but grab a few things every single time you go, an extra few cans of soup, a few extra rolls of toilet paper. Make sure you get an extra tube of toothpaste. Stuff that your essentials, and you know what those are for you and everybody else.
That's sound advice. I still can't find Lysol, though. I cannot find Lysol. Can you help me out with that?
Some things you just can't find, and I don't get it. I mean, even right down to some certain snack foods, they're just
So true. It's so true. I just feel like Lysol should be, just pumping out cans of Lysol, and they'd be making money hand over fist. I literally can't find it. I think I'm going to have to check it out online.
Yeah, I even saw stuff like Dawn dishwashing liquid you couldn't get about a month and a half ago in the grocery store, and now there's plenty of it. And now they're out of something else.
I bought a big one like a month ago. I saw it and I snatched it, a big thing of Dawn. So, all right, Jeff. Anything else you'd like to mention?
Well, I just want to remind people to just keep doing the good work you're doing. Make sure you're wearing the masks. I know we're going to have kids going back to school at some point, and we're just working as hard as we can to try to give the best information people need, and we'll get through it. I just think we're one day closer to beating this, and we started months ago, and we're still going, and we'll get there.
Okay, Jeff. I hope you're right. Thanks for your time. This was a really informative show today. So thank you so much for all the information. And we'll talk again next week.
All right. Thanks, Patty.
Okay, Jeff. Take care. For WestfordCAT, I'm Patty Stalker.